My name is Daniele Massera. I'm a cardiologist, and I am the Associate Director of the Hypertrophic Cardiomyopathy Program at NYU Langone Health. And today, we meet with Tiffany, whose family is affected by Fabry disease. Welcome, Tiffany, and thank you so much for sitting down with us for this conversation. Welcome.
Thanks for having me.
Can you share how and when your husband was diagnosed with Fabry disease?
So my husband had a brother named Michael John, who was about 16 years older than him, and he kept passing out at work. He was having a lot of heat intolerance issues, and they were kind of grasping at straws. So they decided to take him to a dermatologist, and the dermatologist's name was Dr. Walter Shelley, and he was out of the Medical College of Ohio. And he looked in his eyes and he saw corneal whirling, and he got out an old book, dusted it off, and that's when they found out that he had it. And my husband was in the waiting room and they brought him back in and they looked at his eyes and they were like, oh, so in 1985, that's when he got the diagnosis of Fabry's disease.
Wow. So it sounds like a serendipitous encounter with a clinician who really knew about this disease. It was very fortuitous. Wow. How did his story continue? What happened after his diagnosis of Fabry disease?
Well, back then there wasn't a lot of treatment for Fabry's disease. Unfortunately, his brother passed away at a young age. But as soon as we were able to, we got him on Fabrazyme, and we've since then done a clinical trial, and we've switched to a newer drug that we really like. And we just constantly meet with the specialist, make med changes to prevent further organ damage.
So tell me, how does day-to-day life look like for your husband and, for you and your family?
He's to the stage of Fabry's disease where he really wakes up sore. So we kind of just base when we wake up what we're going to do for the day. Um, he requires naps during the day due to the fatigue from his cardiac issues that he has from the Fabry's disease. Um, Gastrointestinal symptoms can be a problem sometimes. So we got to watch diet and what we do when we go out and about. And the biggest thing in Ohio, because we have all of the weather patterns, is his heat intolerance, and he has an issue now with the cold as well. So we just base every day on how he feels and we make the best out of it.
I see. Well, thank you for sharing with us that day-to-day life is, more difficult for him. But tell me, how did his Fabry diagnosis influence your family plans?
So we chose to go alternative options, and we did intrauterine insemination, and we have a healthy 11-year-old little girl. She's not affected by Fabry's disease, but I think it's a really personal choice. I don't find Fabry's disease as a dirty disease or something, but we just didn't want to pass it on. So we chose that option.
Absolutely. Well, thank you for sharing. And tell me, are there any specific symptoms or complications with this condition that have been especially challenging for your husband and for you and the family?
Yeah, Fabry's disease has definitely taken a toll on his body in many ways. The most serious organ that he's been affected with has been his cardiac issues. He suffered from bradycardia, and he ended up with a pacemaker. He has some more dangerous heart rhythms, so they switched to a pacemaker ICD, and he's had a couple cardiac ablations, and so that's really affected him. He has stage 3 kidney failure, but that's been steady with his enzyme replacement therapy, and we really haven't seen changes in his numbers.
Wow, that is very, very encouraging. Tell me, are there certain things that he has to do or certain things that he must avoid?
So we avoid NSAIDs at all costs. We don't want to put any more stress on his kidneys with the NSAIDs. He takes vitamin D. They've recently found out that there's bone degeneration with Fabry's disease. So he has that, and we're just trying to keep his body getting what it needs to take care of his bones as much as possible. he's had to have back surgery due to the bone degeneration, which has been challenging as far as pain management.
So it sounds like you're really driving the point home that Fabry disease can cause really severe impairment of his quality of life, but it can cause, hidden dangers like heart disease or like kidney disease that you don't necessarily feel, but then can determine, your prognosis. So you've been, in medical care with your husband for a very long time. And tell me, what has your experience been like navigating the complex medical care that is necessary for your husband?
It's really important to find the best specialist. I personally we go to Fabry's disease conferences, and you get the best in the world there, but they know the best that didn't come. So it's really important to network to find the best people, because a Fabry's heart is not the same as the same heart like a normal heart. It's going to be infected in different ways for different reasons, and a lot of the cardiologists have an issue seeing why it's happening. They know what's happening, but why is it happening? How can we prevent more um how can we prevent more issues from arising? Can we stop it now rather than watch it go into a later term and be more catastrophic?
It sounds like on occasion you may have felt that you were more knowledgeable than your medical provider about your husband's condition.
We've been at ERs where I've walked out of the room to go get a snack, and we've seen where they Googled Fabry's disease because they had no idea what it was, or they just came in and said, "Oh, it only affects the kidneys. Why is he having a pain crisis?"
Well, power to them for at least Googling. Tell me, what barriers, if any, have you and your husband encountered to, getting timely diagnosis, getting treatment, or even getting insurance coverage of necessary therapies?
We've been fortunate that our insurance is covered. A lot of times it takes time to get in with specialists and get established with them, but we're pretty much established now. We did run into issues when El Fabrio came out that there was only one pharmacy that was distributing it, and they didn't accept our insurance for the supplies. So I was driving about 600 miles up to Toronto to bring back sodium chloride 9%, flushes, IV catheters, and the tubing so I could infuse at home.
Wow, what a powerful story. So you took matters into your own hands, and are you actually administering the home infusions?
Yeah, I went to school to be a phlebotomist, and although it's not the same as starting an IV catheter, I had a pretty good idea what I needed to do. And the trial that was doing it trained me to start IVs so that we were able to do it at home.
Wow, what an amazing story. Um, and tell me about now. We spoke about your husband, but how about you? Have you had access to caregiver support systems, whether formal like social workers or informal like friends or community groups?
Our friend group's been really great for us. They understand the bad days. They really step up when we have hospitalizations and such. We do have care coordinators that reach out, but we're a pretty private family in regards to any struggles we deal with the Fabres. So it kind of just works out that we stick within our friend group. Facebook has a lot of really great Fabry support groups there too that I pop into once in a while.
We're about to end our interview, but is there anything else you'd like to share about your family's experience?
Fabry disease is an invisible illness. Like so many illnesses, it's important to be kind to people you come across in life because you never truly know what they're going through.
100%. Absolutely. That's great advice. Thank you so much, Tiffany. I wish you and your family really a smooth journey into the future. And I wish your husband really all the best. To you listeners, thank you very much for being here. And thank you.